Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kapomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune. Welcome back, Healthcare Boulevard fans. I am your host here, Sena Kapomo, and we are here with another guest speaker. Her name is Melissa, and she is an MRI technologist. I'm excited to get started with her and hear more about her professional journey and what she can teach us about her field and learn more about what it is to be an MRI technologist. But first, let's introduce her. Melissa, welcome to Healthcare Boulevard. How are you doing today?
I'm good. Thank you for having me. Again, my name is Melissa Martinez. I'm an MRI technologist working out of Los Angeles, California, and here to shed some light on the career or whatever.
Okay, let's do it. I love it. Well, how did you get into the field?
To be honest, it was kind of like I always knew I wanted to go into the medical field. I never really knew what, which is why I got my bachelor's degree in kinesiology. Then I took kind of like a gap year, shadowed a couple different professions, and came across MRI and just was really intrigued by the way that you could view the human body non-invasively, and kind of just decided to pursue that. And here I am 2 years later, still in that field.
Oh, wow. Okay, so you've been an MRI technologist for 2 years, is that correct?
Yes, a registered tech for 2 years now.
Okay. Who were you shadowing when you came across, this profession?
Well, I've had like all sorts of different jobs, like server, retail, tutoring, and I was actually working at a medical office. And one of our patients actually came in, and she was an MRI tech, and talked to a lot of nurses, and one of them actually let me go shadow at a Kaiser out in Fontana, and I got to see their whole department, and that's how I saw MRI, and I was like, well, this is really cool, like I want to pursue that. And they were really nice, kind of showed me what a day in the life of the tech would be, and I don't know, it just really intrigued me and decided to go for it.
Right. Okay, so once you decide to go for it, what did you have to do? What's the educational requirement to become an MRI technologist?
Well, it depends on kind of what it is you want to do. Like I said, I have my bachelor's degree, which is not necessarily needed to start MRI school. I did a 2-year program, but because I have a bachelor's, I already had a lot of like the prerequisites. And it only took me about I think it was 12 months to finish it.
Okay.
But usually it's like your AA, and if you want to, you could do a bachelor's degree in it, or if you want to do like a rad tech, you could do like your undergrad in rad tech, and that's like you get your X-ray, your CT, and your MRI license, and you're able to do all modalities.
Okay.
So again, it depends on like what kind of specialty you want to focus on.
Okay, so for you were in a 2-year program. So is that standard for MRI school? Is generally a 2-year program?
Generally 2 years, yes. And then you have to do like your clinical rotation hours, and then you have to sit for your registry exam. And then once you do that, then you get hired wherever you pursue to go.
Okay, and your clinical rotations are after your didactic years?
Yes, after didactic years.
Okay, and in terms of getting into it, what are usually the prerequisites that they're asking for?
You could just apply to school, and then all I had to do was like this. I don't even remember what kind of test it was. It was like a very basic, like elementary level test. And once you get in, like you do all your prereqs, and I guess the main thing they do tell you is like, can you pass a criminal check, like a background check? Okay. Because it is a medical field, and they say like if you finish school and you have a criminal record, then obviously you won't be able to. Your chances of like So that was mainly like the main thing they said, like if you have any kind of record, just to be upfront with them. Other than that, the prereqs, you do them as you go in that 2-year program.
Okay, so it's not something where there's like a laundry list of things you have to take before you even get into the program or anything.
No, like I said, it's included in the 2 years. The classes you'll be taking are like your anatomy, physiology, I think biology, medical terminology, but that's included within your AA.
Within your 3 years. Okay. And that's usually found in an associate. Is it usually in a community college, or do they usually have like a MRI school specific?
Yeah, you could do a community college. You could do even some 4-year universities have it, or you could go to like a private school. And they have like MRI school as well.
So as an MRI technologist, what are you looking at? What's your day like? Let's start with that.
So my day is a little bit long because I work short weeks, long days. So I do 3 days, 12 hours. So it's very busy. I work at a high-paced facility, and the start of my day, what I do when I get in, I make sure the machine's on and working well. I go through my prescriptions to make sure everything matches, start prepping the room. Once the patient's there, I screen them. That meaning that, MRI is a big, huge magnet. So you could really harm someone if they have something in their body, like an implant. So you screen them, you educate them, kind of tell them what to expect. You position them based on what body part needs to be scanned and what the doctor wants to see. You'll position them, you'll do the scan, make sure that everything looks okay, talk the patient through the procedure. Many times doctors want an IV injection with contrast to kind of see any pathologies. The contrast will just enhance that. So we do start IVs. Once the exam's over, we send everything over to the radiologist, make sure we got everything we have. And it's pretty much like that moving forward, like every patient, while still checking all your prescriptions for the next day to make sure there's no discrepancies. So it's very high paced. There's a lot of multitasking involved, but I feel like it's a rewarding job, or rewarding to do like a opportunity to help, in patient care and be involved in.
Right. So you are in an inpatient setting.
I'm in an inpatient setting. However, an MRI technologist could work at no, I'm in an outpatient setting, excuse me. But you could also work like in a hospital. You could work in research. There's even like where you could work with animals, like at a zoo. So there's a lot of different kinds of offices and places you could work at doing MRI.
Right. Is the training the same? Say you wanted to switch to work at a zoo, for example, versus working with human, would you need to do an additional training, or would you be trained on the job?
Many times they'll train you on the job, just because you do have to know your anatomy. Right. So like the human anatomy is pretty much all similar, patient to patient. I mean, we have the same body. But for an animal, you would have to learn their anatomy. So yeah, there's definitely some teaching, some additional teaching that needs to go on before you could go into doing like that animals. And but yeah, I don't work with animals. I work with outpatients. I've done some inpatient where you see non-ambulatory patients, ICU patients. So you could pretty much there's geriatric, there's peds, like there's everything within MRI.
So are you, as you're working as an MRI tech, what other professionals do you work with? Do you interact with, besides, of course, a physician who may be oftentimes ordering the MRI?
It's mainly just for MRI, we have like our front desk. So you work with like your front desk a lot to make sure that the orders are processed correctly. And it's the referring doctors, but the main people we work with are the radiologists, who are the reading doctors. Anything that needs some medical clearance always goes through our medical director, because a lot of times you'll see like patient has this kind of implant and they have no information on it. We have to make sure that we get medical clearance, or if we see something like a patient has like a tumor, we call the radiologist, send it over. He has to tell us like, okay, I want these additional scans, or no, the patient's okay. Just so mainly the person you are in contact with the most will be the reading radiologist, because that's the person that's going to be dictating the exam and doing the diagnostics off of it. So we want to make sure they have a good look at what it is they need to be able to diagnose a patient and get the proper treatment for them.
So it's important to in this position, it seems like, to make sure you're communicating clearly, not just to the patient, but of course to the people that you may need to talk to make sure they can help you either clear the patient to do the MRI or send them for another scan or so forth.
Exactly. Yeah. So there's like a lot of the times, like there's multiple doctors involved. Sometimes you have a really easy patient or it's just a standard routine and you don't even have to talk to the doctors. You just send everything over. Right. But then you do have those complicated cases where it's like, oh, I was a welder. I got like metal in my eyes, or I have this implant. It was implanted in like the 50s and I have no information on it. Mm-hmm. And then sometimes you have to send them over to get like an x-ray to make sure they're clear to go into the MRI. Because again, it's a big magnet and magnets and electronic devices don't always mix well.
Right. Okay. And in this position, what would you say is your favorite part of the position?
Being able to see what like the actual anatomy looks like seeing the muscles, the bones, the tendons, and even how to see like what pathologies look like. Like I grew up playing sports, so I would get hurt a lot. So when I have patients that come in for like, I don't know, like a sprained ankle or a torn muscle, it's really cool. I mean, it's unfortunate for them, but it's really cool to be able to see what that looks like non-invasively.
Right.
So that's, I would say that's like one of my favorite parts, is seeing like what a disease looks like, what a broken bone looks like, what a strained muscle looks like.
Right. You're able to see things that normally you wouldn't be able to see with your naked eye, or be able to touch, but you know it's there because you can actually see it.
Yeah, exactly.
And what's your not so favorite part or challenges?
Like anything, patient care. It's always the patient. You don't know what you're gonna get. For the most part, they're usually like, very nice people. In an MRI, you're gonna come across a claustrophobic patient, and that's where you'll really have to be patient and kind of get them through it. Sometimes you won't have a success rate with them because that's just like a mental block that a patient can't get through. And I guess like the bigger picture of like MRI, I would say the toughest part of it is if you work at a facility with a high volume, which is kind of where I'm at, you're constantly like moving, like you have to stay on time. So not only do you have to provide like good patient care, you also have to do it quickly. Because if you fall behind an MRI, everything's timed. Like each scan, you get a certain amount of time for. And like if you're like 1 minute behind, it just snowballs and you could end up being like 20-30 minutes behind by the next patient. And the following, it's just longer and longer. And it delays your whole day. Then you have the doctors that are upset with you, the front is upset with you, the next patient's upset. So time management is probably the toughest thing to stay on top of while I'm working.
What do you usually do for those patients who have claustrophobia, who are claustrophobic?
So it's just educating the patient, making sure that they feel comfortable. Always reminding them that they're not alone, and that ultimately they have the choice if they want to proceed with the exam or not. It's just a lot of patience and like a lot of babying them, and reminding them that they're in control. And what I do usually, like in MRI, you have like a speaker, like an intercom, where you can communicate with your patients. I just check in with them, tell them how much time is left, and kind of some reassurance that they're doing a great job. Like I said, patience is like the biggest thing, but it's also hard because you only get a certain amount of time.
Right.
And again, not all facilities are such high volume and high paced, but in the environment I had to kind of learn to work fast, but still provide great patient care. And I've been doing that for 2 years, and I think I've gotten the hang of it.
I believe it. Now, do you have a specific demographic of patients you're working with oftentimes, in terms whether it's age or different diagnoses? What are usually the patients walking through?
Yeah, so for the office I work at, like I said, I'm in an outpatient office. So our patients aren't necessarily like bedridden. They're not like critically ill how you would see in a hospital setting. Right. But I do see most of my patients are like mid-age patients. I get a lot of geriatric patients, and we see occasional peds as well, like little kids. But mainly all my patients are ambulatory and coherent. They're self-sufficient. They could get themselves in and out. opposed to like a hospital setting, which I've seen, which I've actually been in, and you have to, sometimes you're working with patients that aren't even like awake. So, and again, each setting has their own demographics they see, but for the kind of setting I'm in right now, it's all outpatient ambulatory for the most part. You'll get like people in wheelchairs, but they're still like functioning and able to move themselves around.
Okay. And in terms of your shift right now, you say you work 3 days on a weekday and twice a week, 2 days a weekend. Is that normal for MRI tech, or what's the usual shift?
For usually you'll get like a normal like 8 to 5 or 8 or 9 to 6, 5 days a week. And then a lot of the times you have like a morning shift, and you have like the mid shift or the night shift. Again, it depends on the kind of place you work at. Hospitals have, I believe, 3 shifts, and then like you're on call as well. My office, I do 3 days, 12 hours, occasional weekends, and then sometimes we'll pick up a 4th day if the volume is really high. But majority of places you do work like your normal 8-hour days. And they're usually, if they're an outpatient center, they're usually from like 8 to 5.
And again, with that being said, how would you say your work-life balance is with this position?
It's, I feel like I have a good balance. The 3 days, for at least in the current position I'm in right now, I'm only there 3 days, so I have 4 days off. Sometimes it could be a little unpredictable, but I do feel like I have enough free time. Although I'm stuck at work literally from like sunrise to sunset, like on the days that I do have off, I'm free, like they're off for me. So for that particular schedule, I do feel like the work-life balance is good, because it's not a career where you take your work home. Like how some doctors, or like even I feel like teachers, they take their work home. We don't have to really worry about that. We clock out and you're done for the day. The next day is like a fresh start.
Right. And what are opportunities for furthering your education / career as an MRI tech?
So an MRI, there's like different levels of it depending on like the setting you're in. Again, the setting has to do a lot with how they operate. You could start off as like a tech aide, and from a tech aide, that's like the person who just helps the technologist like bring patients back, set them up. From that, you can move into tech 1 position, which is like doing like the basic routine scans. There's like the tech 2 who does more of the specialty scans. There's also a thing called MRSO, which is like an MRI safety officer, who could then take on the role of making sure that we're operating with the safe guidelines to keep our patients and like the site safe. And then I've actually also seen technologists jump into like operations and management. So there is a lot of growth within the field, if it's something you're like wanting to do. I know 2 different people who have jumped from like a tech position to a management position. And again, it kind of just depends on what you see yourself doing, and if you want to stay as a tech or if you want to grow within it.
And for you particularly, what are your future aspirations, as if professionally speaking?
Yeah, see, like that's always like a funny question when I get asked, because I feel like my kind of personality, I'm someone who likes to keep learning. And as far as like for the rest of my life, career wise, I really don't know what it is I can see myself doing for the rest of my life. Like right now, I'm happy doing this. It'll definitely be something in the medical field, but I'm open to adapting into like new roles, depending on what it is that interests me at that point of my life.
Right. That's a very liberating way of living your professional life, for sure, because I know it can be a lot of pressure, try to get to this or get to that, but it's nice to see somebody who's just enjoying what they're doing and ready to take on the challenges as it comes. So thank you for that. But I did want to ask you before I let you go, are there specialization in MRI technologies Like, can you specialize in, let's say, certain specialties like OBGYN, MRI, or like brain, or like heart, or what have you?
Mainly like you could do, once you become an MRI technologist, you have to learn how to scan it all. There is like sites where you could specialize in like breast MRI, but in MRI it's not as popular to do that, just because when you're hired, that particular like position will want you to know how to scan everything. They don't want to like hire someone who only does this or only does that. You're pretty much not expected, but they want to have someone who's well versed in all types of scans. But with that being said, like there is some techs who know more. Like I'm still a very new tech, so I'm still learning, but you do have techs who like know how to scan like cardio, like the heart, the vessels, like runoffs. Those are specialties you could pick up, but it's not something that you'll just be expected to perform all day. But again, it will depend on the facility, like the kind of setting you're in. But for the most part, you want to be well-rounded and know how to scan everything. That's usually what a position will want to.
And also that's how you're trained, right? And you're trained to understand and be able to scan everything.
Exactly, yeah.
But like if you were hired by cardiology, so to speak, then by the time you get out of that position, you'll be know all about the heart and maybe lacking a little bit on your ortho, so to speak.
Exactly. So again, it goes working, like where you work, the setting you work in, and what kind of, like, a lot of the time I've seen that it depends where the location's at. Like for us, I was doing my student hours at an outpatient center that was by I can't remember what kind of doctor he was, but all we would see was MSK. And it was like a lot of joints and ortho, I guess. But yeah, it depends also where the facility is located, what kind of doctors refer to you.
Right.
So yeah, if you have like a cardiologist working down the street, they'll probably refer a lot of their patients to you. And again, I work in LA and like the medical plaza, so we see it all.
Everything.
Yeah.
If you don't have anything else to add, what are some advice you may have for folks who are wanting to get into that field as an MRI technologist?
My biggest advice, because it's what helped me the most, would be try to see if you could find someone that'll let you shadow them and really get to see what a full day of being a tech is like. Because it is a lot of, you're on your feet. I'm on my feet pretty much all the time. Moving, scanning, the kind of the pace, the environment, and the kind of personality. It also takes you have to have the right personality to be able to adapt to every kind of patient, and being able to experience that in person is going to be key to like knowing if this is something that you'll be happy doing or not.
That's fair. Well, that is all I have for you today, Melissa. Thank you so much for joining. I appreciate you taking the time off your beautiful Sunday for joining us here on Healthcare Boulevard. That's it. Have a beautiful evening and beautiful day.
Thank you. You too.
Alrighty. All right. That's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.